Since 2009, Tony Iton has served as Senior Vice President of Healthy Communities for the California Endowment's 10-year Building Healthy Communities California Living 2.0 initiative. And the goal of that effort is to create communities where children are healthy, safe, and ready to learn. Prior to his appointment at the Endowment, Tony served since 2003 as the Director and County Health Officer for the Alameda County Public Health Department, where he oversaw the creation of an innovative public health practice designed to eliminate health inequities by tackling the root causes of poor health that limit quality of life and lifespan of many of California's low-income communities. And I think that Tony really is one of the people on the national and California public health landscape that has most articulated the relationship between place and health and how communities need the basic ingredients for health in order to have healthy people. Tony also served for 3 years as the Director of Health and Human Services for the city of Stamford, Connecticut, as a physician in Stamford's HIV clinic, as a primary care physician in the San Francisco Department of Public Health, and as a staff attorney and health policy analyst for the West Coast Office of Consumers Union. So it's a pleasure to introduce Tony.
Wow, a really bright light up here. Okay, so there's been a coup at the California Endowment. I've taken out Bob Ross, and I'm in charge now. Actually, Bob's going to be here pretty soon. He's on a plane right now. He was just appointed to the California Exchange Board to try to keep California in its sort of #1 position in implementing the Affordable Care Act. So he's pushed off a lot of his responsibilities onto his supporters, and I am one of his supporters. However, I did not realize that he is in fact a dignitary. And so I am now a dignitary, an honorary dignitary. And so I'm going to do more of his speaking, because being a dignitary is like something that we certainly don't treat him that way. But now I know. I do want to say that the California Endowment is extremely privileged to be able to participate in partnership with so many active leaders around the state that are determined to make a difference in childhood obesity prevention. And we're particularly proud of our community leaders, and we have community leaders all around the state and certainly in San Diego, many of whom are in this room, who've been doing really cutting-edge work and have taught us a lot about what the most effective strategies are, despite the apparent lack of research evidence. We actually believe that we need to continue plowing forward, and that's what my remarks are really going to address. Before I get there, though, I want to do two things. I want to do something a little bit unusual. Maybe it'll sort of get you sort of your blood flowing a little bit. But I want to thank a partner that is of particular benefit and importance to us, and that's Kaiser Permanente and their leadership there. Very unusual organization. It's a multi-headed hydra. You never know who's running what. But all of the heads are charming and helpful and committed to childhood obesity prevention. So thank you, Kaiser, for your leadership. You're showing the world, essentially, how a healthcare provider really can make a difference in this area. My kids talk about the Thrive commercials all the time. And so we're really honored to have you as partners in this. The second thing I want to do is a little bit weird, so forgive me for doing it, but I'm filling in, so I get to do whatever I want. And that is that I have a daughter, and we're making a documentary film about her life. And the plot of the film, I'm not going to get you into the whole thing, but she's 13, and she's a great kid. And so I need to enlist some of you in a little bit of filmography here. So what I need you to do very briefly is to just chant her name. Her name is Angela. So I want to hear, not yet, I want to hear Angela, Angela. And you can stomp, you can pound on the tables, you can wave, you can do whatever. and you're going to be in our film. So let me just get the right device out here. Okay, there's the camera. And let me get to video here. Okay, you ready? You ready? 1, 2, 3, go for it. Beautiful. Thank you. Thank you. That was beautiful. I mean, it's rare that I get up in front of a couple thousand people, so you got to take advantage of it, right? Okay, so thank you. So I have some slides I want to show you, but I want to be a little bit provocative because I think that you know, I suspect, and I won't ask, but I suspect a lot of the people in the room here are pretty much public health people, nutritionists, registered dietitians, school folks, you know, some public health department folks, and you guys get this stuff. The problem with the childhood obesity epidemic is not you. The problem is there's not enough of you, and our influence on people who are not you is not that great. So the question I have for us all is, do we need a movement? And if we need a movement, what does that take to construct? Let's see, so this is a slide thingy, no doubt. Okay, good. Okay, so childhood obesity is one of our biggest goals for the next decade at the California Endowment. We're funding aggressively and working with partnerships in school food and physical activity programs. We're pursuing a lot of the things that Linda was talking about, the safe and walkable streets, parks and open space, healthy food access, and in fact, I think you'll hear about our fresh food financing initiative, FreshWorks, at this conference from Charles Fields, who's probably here somewhere, or he'll be here tomorrow. And of course, my particular interest is in robust community participation, engagement, and equity. And I know we cannot be successful unless we have very significant level of community participation, particularly amongst low-income communities of color. Our policy targets, just to put in a plug for things that are real, that are happening now. I mean, Linda talked about wicked problems. Steve talked about, you know, wicked research challenges. I want to talk about wicked solutions. I think that there's some stuff here that we can really nail down. The Healthy Hunger Free Kids Act passed in the recent lame duck session, and we need to make sure that it's implemented completely and appropriately. We need to protect means. Thank you. We need to protect our, some of our means-tested programs, especially the food stamps, from cuts and the effort to block grant them, and that's real. That's happening now. We need to get involved in that and prevent that. And we need to fully implement California's Childhood Obesity Prevention Program. It's a great program. We need to roll it out and get it throughout the state. Thank you, Linda. And Peggy. So what's going on out there in the public's mind? Well, the good news is that people are kind of with us. They understand that this is a big problem. In a recent field poll on healthy eating was named children's greatest health risk. Lack of physical activity actually tied for second. These concerns have been rising steadily in poll after poll over the past decade. So we kind of have the public with us in terms of front-of-mind attention to these issues. Prevention continues to obtain very high support in people's minds. So prevention-oriented policy will actually gain traction in the general public. We just have to figure out how to take advantage of that. At this conference, one of the goals is to continue to build a movement of scientists, practitioners, elected officials, residents, parents, youth, and other stakeholders to embrace the concept of health in all policies in order to change social norms and practices so that healthy eating and physical activity become easy choices for all children. So there's a lot in that. It was actually quite well written. We're focusing on changing social norms. We're trying to change the way people understand their environment. What is normal and what is abnormal? And in order to do that, you have to get these issues in the front of people's minds. They have to be able to see the invisible structures and barriers that make it difficult for many of us to pursue healthy choices, and particularly if we're low income and of color in this state and elsewhere, the opportunities to pursue those healthy choices are few and far between. The barriers are substantial. But the notion of a movement is actually one of the goals of this conference. So do we need a movement? What is a movement? A social movement is a loosely organized but sustained campaign in support of a social goal, typically either the implementation or the prevention of a change in society structures or values. Although social movements differ in size, they're all essentially collective. So we need to enlist other people's participation. They result from the more or less spontaneous coming together of people whose relationships are not defined by rules or procedures, but who merely share a common outlook on society. So in 2008, when we were planning our Building Healthy Communities initiative, we actually investigated this concept of how do we build a movement? And we wanted to build a movement for a progressive social change in this state. And I remember I participated in one of those conferences as a health director, and I remember the consensus in the room was foundations don't build movements. And I think that that's probably true, but I think there's a caveat, and I think foundations can help fuel existing movements, can help galvanize potential movements. Our role is that of a catalyst, but the real movement comes from community. And I think that we may be on the precipice of a real movement here around childhood obesity prevention. We have to find the messages that engage the public, though. So, if a movement was happening, would we even know it? I want to just leave you with a couple images that I'll come back to towards the end of this. We all remember this, or maybe some of you weren't born, but it's 1994, so hopefully most of you were. This was a movement, and the people who put this together are very good movement builders. This was on the New York Times front page yesterday. And as I was scanning the New York Times, I saw an article about gay marriage and the New York success, and the fact that they would face some hurdles around the rest of the state trying to replicate what happened in New York. There was a study looking at a stealth survey of physicians' offices, trying to figure out whether the primary care access that people advertise is real. And then there was this article, which is, let me zoom it in for you here. Across Europe, irking drivers is urban policy. Cities are discouraging car use, closing streets, driving up taxes, making parking either impossible or very expensive. It's a movement. It's a movement to change the way we interact with our environments. And it's a very successful and well-received movement, except by car drivers, obviously, in many European cities and European capitals.